I'm Dr. Manoj Duggal, practicing cardiac electrophysiologist for over 20 years in Chicagoland area. Quite frequently we get patients who are referred to us who have congestive heart failure which has worsened, and when you start looking into details, their right ventricle pacing has made their ejection fraction worse and they have symptoms of heart failure. More importantly, the question I want to know the answer to is, when did this start? Could this have been prevented? Or could this progression of the disease have been slowed down? We all look at our patients and we try to do a very good job of not patients have RV pacing. But still, as their disease progresses, the use of medications for heart failure and antiarrhythmic agents, their conduction system gets worse and they start pacing right ventricle more frequently than we like it to be, which makes their heart failure worse. So I was very interested to see, despite good surveillance we have, are we still missing some patients who could be helped in timely fashion? The fact that RV pacing is detrimental to some of our patients who have ICDs and heart failure, we all try to do a good job on making sure that these patients do not pace in the right ventricle or at least minimize their right ventricular pacing. Despite that, we see patients whose heart failure get worse because of RV pacing. So I wanted to closely look at my practice and see, are there truly any patients who we are not focusing on, and can medical management changes help their outcomes? I'm a part of a large cardiology group. We have electrophysiologists, heart failure specialists, and general cardiologists taking care of these patients. We make every effort that these patients are not pacing in the right ventricle, or if they're pacing minimally. This data which we received from this pilot project showed us, despite our efforts, there were some patients who fell through cracks and they were pacing in the right ventricle more than 40%. After I got the patient list who were pacing more than 40% as part of the pilot project, I reviewed all their charts. I discussed the care plan with their cardiologist and heart failure specialists. Patients primarily fell into three groups. Group 1, who we felt, despite any medical management or reprogramming, they will continue to pace in the right ventricle as they have developed complete heart block because of medications and the progression of their disease. Group 2 were patients who we were able to reduce their medications or reprogram their devices. Despite that, they continued to pace more than 40%. The last group was patients who we, on clinical exam, had no symptoms, but their imaging showed their left ventricle systolic function has deteriorated. So 3 actions primarily were taken. 1 were medication adjustments, reprogramming of the device, and if none of these 2 or combination of the 2 helped the patient, we offered them more physiological pacing like resynchronization therapy, especially in patients who had severe symptoms and who were close for their ICD batteries to be changed. The key is to get this information in timely fashion so you can intervene so the disease doesn't progress further because of continued RV pacing. I think it has raised the level of awareness amongst all of us to look into these patients who have devices so that they do not pace in the right ventricle excessively. Remote monitoring has given them reassurance to the patients and their family members that their devices are being looked into closely. As physicians, we know what is the health of their device and if you need to make any medical changes which can be performed remotely. We all know that this data is important because we don't want our patients to pace in the right ventricle. So be vigilant, get this information, and make changes in your patient's management, which include medicines or reprogramming, so they do not pace in the right ventricle. We constantly get bombarded with patient information, but this is important information. You want to know patients who are pacing in the right ventricle more than 40%. I would say initially following this data maybe every 3 months. Once you have a good handle of the patients who are pacing but not as frequently, then this information can be customized to maybe every 6 monthly. But I think it depends on every practice, and the beauty of this is this can be customized. It was pretty simple to sign up for the process. If you have patients who are enrolled in Medtronic CareLink, you can email the CareLink team and telling them that you're interested in getting this data and at what frequency. You can have further information from your sales rep who can guide you through this process.